The Daily 2 is brought to you by Charlotte Eye, Ear, Nose, and Throat Associates. Welcome to the Daily 2. I'm Laura Polka. We are on location today at CEENTA's Monroe office talking about ear infections with Dr. Lindsey Trefz. Thanks so much for being here today.
Of course, thanks for having me.
Doctor, what causes ear infections?
So it's going to depend on where the ear infection is located. So if it's a middle ear infection, like what you would think when little babies get ear infections, that's behind the eardrum. It's really common to get that when you've got a lot of nasal congestion, nasal drainage. You'll hear people talk about like a daycare nose. You know, you'll start having all that, and then typically then they can start complaining about ear pain, and then they'll be diagnosed with an ear infection. That's pretty common for children. Can also happen in adults after an upper respiratory infection, even a viral infection.
Is there any way to prevent an ear infection?
Yes, you can. For adults, for example, treating the nose and trying to prevent some of that chronic nasal congestion can help at times. For little kids, generally speaking, the younger they are, we end up recommending ear tube placement depending on how many infections they've had.
And how do we know when it's serious enough to come to the doctor to take?
Right, so it really kind of depends on the kid. So if we're going to talk about the little ones, for example, coming in and out of the pediatrician's office, every time they go in they get an ear infection, or the infection goes away but the fluid never clears. They develop issues tolerating the antibiotics that they have to take by mouth, or develop an allergy, or there's concern for hearing loss or speech delay. So then you'll come in and we'll be able to evaluate them.
And all the treatment options available here at the Monroe office?
Absolutely, yep. So we do the hearing test, take a look at them, and then decide whether or not they'd be good surgical candidates.
All right, doctor, thanks so much for being here today. We appreciate it.
Absolutely.
If you'd like more information, call the number on your screen or go to CEENTA.com.